name is Kate Darty Schmeck, and I am the Executive Director of the Global Alliance for Rheumatic and Congenital Hearts, Global ARCH. I'm excited to share more today about the importance of patient and family organizations, and as well as the role of Global ARCH and our strategic direction. Patient and family organizations are at the core of Global ARCH's mission. They're often founded by patients or families personally affected by childhood onset heart disease. These groups arise from a desire to address critical gaps in support and care. They don't replace clinical care, but they strengthen it. They become lifelines by providing essential resources, guidance, and peer-to-peer support. They help to alleviate the burden on healthcare providers and to address the unmet needs of patients and their families. But these organizations do much more than offer peer-to-peer support. They advocate, they educate, and collaborate. They work with healthcare providers to bridge gaps in care, ensuring that the voices and needs of patients and families are heard. These organizations tackle key barriers by funding transportation, mental health resources, surgeries and other care, and also other key essentials. And that's just not for patients and families, but also for clinicians as well. By fostering communities outside of clinical settings, they complement the role of medical professionals, enhancing patient care and supporting clinicians in meaningful ways. Patient and family organizations also partner with and fund research. They collaborate with healthcare professionals on education, and they work with governments to improve access to diagnosis, funding, and lifelong care. I could present all day about the impactful work that these organizations do. However, I know we don't have enough time. So I'm really excited to hear more throughout this virtual summit of some of the work that these
Eles estão me
organizations
ouvindo
are
agora,
doing,
não? Aí você pode falar, eu faço de conta.
and also look forward to highlighting more at future events and projects. As we all know, this work is not without its challenges. These organizations often operate with limited resources. They work in silos. There is uncertainty by others, sometimes even clinicians, about the role of these groups. And they're also facing geographic separation. Yet, despite these obstacles, they remain a vital force for change. Myself, I'm a family member of multiple people impacted by congenital heart disease, including my brother and my grandmother-in-law, my husband's grandmother. And I witnessed how the invaluable support these groups play and how it fuels a vision for a more inclusive and an equitable healthcare system for all. So what about Global ARCH? Well, Global ARCH was formed as a call from these patient and family organizations who, as they wanted to grow their impact and break down those silos. So Global ARCH is an alliance of organizations from around the world that seek to improve the lives of those who are impacted by childhood onset heart disease, including rheumatic and congenital heart disease. We work with over 110 organizations, but the biggest focus of our work is uniting and empowering patient and family organizations. Our work continues to focus on our vision that every person impacted by childhood onset heart disease receives the lifelong care they need to live life unlimited by their disease. But what do we actually do? Well, we believe in the power of collaboration in order to really create lasting change. By breaking down silos and working together, we focus on building a global community by uniting organizations from around the world, connecting patient and family groups, medical professionals, and other key stakeholders. For our members, we strengthen communication through online platforms like WhatsApp, social media, and virtual and in-person gatherings. Our goal is to create a robust and supportive network that drives that real change forward. We're a collective voice. We work together to bring the patient's voice at the forefront and to accelerate policy change to improve the lives of those who are impacted by childhood onset heart disease. We partner with the medical and research communities to ensure patients and families are meaningfully engaged and included in decision-making. We help to build the capacity of patient and family organizations by empowering and equipping local leaders with non-financial resources like training, mentorship, and access to educational materials. The goal is to help to lead change in their own communities. And we do that with current existing groups, as well as identifying new leaders in collaboration with medical teams. Overall, we bring together over 113 member and partner organizations from 47 countries. 78 of these are patient or family-led organizations, and that can include anything from a WhatsApp or a Facebook group to large foundations who are funding patient care. We collectively serve over 88,000 patients yearly. 63% of these patients are defined as underserved, and 53% of our member organizations are in low and middle income countries. We're incredibly proud of Global Arch and the incredible work our members are doing. I continue to be amazed by them every single day. However, we all know, and we talk about this often with our members and each of you, is that childhood onset heart disease remains largely invisible. It leads to preventable deaths and disabilities. As Global Arch is the largest alliance of patient and family organizations impacted by these conditions, we know we need to do more. We need to bring our community together in a more meaningful and impactful way. And our mission remains clear. We need to support the millions who are impacted by childhood onset heart disease. So today, I'm thrilled to share how we're building on our current success and our strategic direction to accomplish even more. We're excited to share a little sneak peek into our new initiative, Invisible Hearts Collective Action. This will formally launch in December this year. Together, our goal is to reach 500,000 lives annually with support and services, and to position childhood onset heart disease, including CHD and RHD, at the forefront of global health discussions by 2030. Our vision for this initiative centers on expanding our impact and strengthening the voices of those who are impacted by these conditions. It builds on our past success and incorporates our strategic direction moving forward. But how do we actually plan to accomplish this? Well, first, we're expanding our reach. Our goal is to continue strengthening patient and family-led organizations by working with our current members, other existing groups who are not yet part of Global Arch, or helping start new ones in areas where there are none. We'll work to empower them to provide essential support and create lasting change at local levels. A lot of what they're doing already, but really helping to come together. Next, we're mobilizing advocacy. We aim to raise more awareness, reduce stigma, and ensure childhood onset heart disease is recognized as a priority within the global health agenda. This builds on our current advocacy work we've done with our partners and our patient and family leaders to drive policy change and improve care. We're also focused on building a strong and meaningful partnerships. By collaborating with healthcare providers and hospitals and other key stakeholders, we can create systemic changes that align with our vision for better global collaboration for childhood onset heart disease and create a more sustainable impact. And finally, we're committed to, of course, empowering our local leaders, our patient and family leaders. Through specialized training, we aim to equip leaders around the world to grow support for patients and families and strengthening our local communities. Overall, our progress has laid a strong foundation, and we're excited to share more about this initiative, including very specific details and information in the upcoming weeks as we formally launch the initiative. Before I wrap up, I want to quickly just talk about how does this actually play into the larger global health goals and why 2030? Well, through this collective effort, we aim to contribute to achieving the Sustainable Development Goals created by the United Nations on how we all can work together to make the world a healthier and a better place by 2030. Particularly, we'll focus on SDGs 3 of good health and well-being, 10 of reduce inequalities, and 17 partnerships for the goals. We'll share more during our formal launch of how we align to each of these goals and how childhood onset heart disease is really integrated into the broader global health agenda to advance universal health equity. We can't do this alone, though. We need your help. Every person and organization that joins us strengthens this collective action, contributes to our mission of empowering patient and family organizations, and helping to improve the lives of those who are living with these conditions. So how to join? Partner with us. Let's unite to drive real change together. Spread the word and amplify the voices of patients and families, raising awareness worldwide. And support our vision by donating to or collaborating with Global Arch to reach 500,000 lives annually, collectively with our members by 2030. Together, we can ensure that no one faces childhood onset heart disease alone, and that every person impacted has access to the care and support they deserve to live life unlimited by their disease.